Hello, good morning, good afternoon, good evening, hello, good day. Dr. Maria?
Good morning. She said everything the same.
I'm loving the backdrop.
Yeah, today we are actually guests in another clinic because my clinic is getting renovated. We get a very nice renovation. So this week we are in Marina in the medical clinic, not in Marina Aesthetics.
And today we are talking about a hot topic, which is weight loss, weight gain,
Yes.
weight gain during menopause. How many women mention it when they come into your office?
Maybe 9 out of 10.
Yes,
you know.
exactly. It's huge.
It is one of the most common, along with brain fog, weight gain are the most common symptoms and most common complaints that women are coming to my office. Yeah.
And it kind of hits you like you're doing what you've always done in your life, and suddenly it doesn't work any longer.
Exactly. This is what exactly I was telling now. Was a patient here. She's actually a personal trainer. I don't know if you saw her.
Yeah.
Very fit, very beautiful woman. And she was telling me, I don't get it. I do exactly the same exercise. I eat exactly the same. And still, things I have put on 3-4 kilos and I cannot get rid of that. And I'm telling you cannot expect that you will do the same things as you used to do 5 years ago and you will have the same results. It's not possible. You're not the same person anymore. So this is what we have to realize, that coming into the perimenopause, menopause, and it's not only about the hormones, it's the age as well, you know. Let's say you're not, you don't have any issues with your hormones, although anyway, when you know, as we age, our hormone levels are changing. But even without any hormonal changes, just because of the aging, what happens, and that's the most important thing, is the insulin sensitivity in our body. So our body metabolizes slower, and it gets, as we age, less sensitive to insulin. So even if we don't have officially insulin resistance, which is a condition, we call it like pre-diabetes. So even if you don't have officially that, even if you do blood test and your insulin resistance index, whatever we check there, looks normal, still it's not the same as it used to be a few years before,
Right.
you know. And
So due to age, it is going to change.
exactly,
Right.
it is going to change. And this is what we have to understand, that we have to work towards to increase the sensitivity of insulin. Because insulin, what is insulin? Okay, so insulin is a hormone that will be produced in our pancreas, this organ in our body, and then makes our body sensitive to take the glucose and work out and metabolize the glucose, okay, and give energy to our body. So we need insulin in order to metabolize the sugar that we are taking or the carbs that we are taking. We need insulin, and we need also insulin to be able to be used by our body, by our tissue, okay?
Right.
And that's the sensitivity. It's not important only how much insulin you have, that's also important, but it's not the only thing. It's also how you respond to insulin,
Right.
okay? So, and this is what is happening with aging, that our body is not responding well, or at least as well as it used to do when we were younger.
So is that insulin resistance?
Yeah, again, so it's not insulin resistance, it's a medical condition. It's something abnormal, okay?
Right.
Or insulin resistance means pre-diabetes.
Okay, so the age thing is not that.
So it's sometimes you have that, you
Right.
can see it in the numbers when you do your blood test, you can see it. But sometimes you see that it's normal, but still it's happening because the sensitivity is not the same anymore. So you don't have a resistance, but you are not as sensitive as you used to be. I don't know if you understand the difference, right? It's a different thing to have an abnormal medical condition and a different thing not to function optimal. Again, it's about optimization. Even if it still, look normal, and it might be normal, it's not optimal. So what we have to do is to optimize our insulin sensitivity.
Okay.
When we're talking about weight, we have to be very, very careful with our hormones, some certain hormones, like the cortisol levels, okay? So we have to bring our state where the cortisol level will be low. Cortisol is the stress hormone, okay? And stress hormone is a signal for our brain. It's an information for our brain that we are in an emergency, let's say, situation. So what happens in that case when we are in an emergency situation? Our body is very clever. So our brain will say, look, you are in danger, so you need to have energy, storage of energy, so you need to have fat. So what will happen? The fat will be kept into your body.
Right.
And you cannot lose weight. So you can have the best diet in the world. You can have the best exercise. Still, we will come to that. We will come to that. Exactly. That's also very important. And still you don't lose weight because you are stressed. You're very, very stressed. Your cortisol levels are up. Okay. The lack of sleep is also an information and signal to your brain that you are in danger, that you're not doing well. So in order to lose weight, your brain has to take the signal that you are not tired, that you are not totally, drained, physically, emotionally as well, and you are ready to thrive. So losing weight is putting ourselves in a state that we are ready to thrive. So we can take the next step to become better. If we are in a survival mode, which we are, exactly, which we are. You think that our body is that stupid that will think, okay, she has to survive now, but let's make her thinner. No, she will try to keep your fat and give you energy for the danger that you are in and always help you with that.
Right. Okay.
So sleep, let me tell you about sleep. We need at least 7 hours a day.
Yes.
Okay. I know it's not easy, but it's something that we can train ourselves to do so. Okay. So the most important thing in order to sleep well in the night is to wake up in the morning, and the first thing you do is to go out and see the morning light and have an exposure to the morning light at least for 5 minutes. Ideally maybe 15 to 20 minutes, but if you have it even for 5 minutes, and if you do it even if the day is not sunny, it's not a sunny day, it's a rainy day, still you will benefit, because that regulates our melatonin.
Right.
Okay, melatonin is the hormone that we need in order to keep the right circadian rhythm, so the sleep and wake cycle, So if you have melatonin in the morning, then your body gets regulated well from early in the morning. Okay, so that's number one. Number two, we all need to have a routine, like children, right? The children, they have a routine. They take their bath, right? They relax. They go, they listen to a story and so on, and then they fall into sleep. So the same, we need the same.
Yes.
If we take our iPad and our iPhone in the bed.
2 a.m. No, that's 2 a.m. is the morning. You can't go to sleep at 2 a.m.
No. Ideally, a good time to sleep is around 9 to 10 o'clock.
Yeah.
Okay.
We start getting ready for bed at 9:30 and we're in bed by 10.
Exactly. So that's ideal. Anyway, everyone has the lifestyle.
Early.
Eating early.
If you're going to go to bed earlier, you've got to eat earlier.
Exactly. So ideally, again, you shouldn't have eaten anything for 3 hours before you go to bed. Okay, if that's not possible, at least for 2 hours. You can have water or tea or something, without sugar, maybe up to 1 hour before bed, but nothing more than that. So what I was saying about routine is very important. Don't take iPhone, don't take iPad in your bed. That's a huge irritation for your hormonal system. And if you do so, if you can't help it and you have to do, then just put there is in
The light.
Yeah, the light.
Dim it.
Dim it, and
Yeah.
also there is a regulation setting that you can make it warm light. Okay, so I have it in my phone, for example, every day
Yes,
at 8
I
o'clock.
put it on sleep mode or whatever, and it dims it.
Exactly,
Yeah.
dims and becomes red, because the blue light is a very bad light.
What
Okay.
happens if you sleep at 2 for continuously 2 months? It's just that your brain is full of stuff from the day, and you need the sleep to empty the dustbin, basically.
Yes,
Your
yes.
brain health is so important,
Yes,
and it gets its health from the sleep. So you're never emptying
yeah.
your bin.
Actually, the sleep is the time where we regenerate. That's the cheapest and most powerful anti-aging medication, right? So we really need that. It empties, and it also transfers trash, indeed, the things that we don't need in an emotional level, mental level, but also physical level. So it's prevention for Alzheimer, for dementia later in life. But it has to do also with weight loss. Okay, so we will have a life only for sleep, because it's so interesting.
Yes, it is huge. When you said how do we optimize our insulin sensitivity, you said that's what we need to do?
Yes.
Are
Yes.
you going to
Food
say how?
for sure. Food
Right.
for sure. And exercise as well. So lifestyle changes. Lifestyle changes means the right food. We will not discuss today about the food, because that's another huge chapter. But yes, optimizing your diet, optimizing your exercise. Now, about exercise, I want to tell you something. Exercise is very good, but if you exercise too much, is not good. Okay, because again, you will find yourself to go for hours in the gym, working so much and not losing weight. And the reason is, again, because you stress your body. You have high cortisol if you do that, and again your body says, I am in danger, so I will not, I will not lose weight. I need my weight. So moderate exercise, yeah.
And there is really no point in stressing yourself with the exercise if you're not sleeping. That has to come first.
Exactly, yeah.
You can't be doing all of the other things, like the crash diet, which is going to stress you, the exercise, stress, and
Like
the sleep.
everyday
You've got
exercise, going to,
just too much.
yes,
too much. So sleep first, food next.
Exactly,
Then exercise.
the right exercise. Just simple things. Even walking every day for 20 minutes, it's absolutely fine. It's absolutely enough,
And don't beat yourself up about the exercise.
Exactly, and don't, we find excuses, and myself also included. I will have to go to the gym, I have to make time to go to the gym, actually it's easier, it's much easier than that. You just go outside and you walk, or you take your bicycle and you have a nice fun, or you just go for swimming, whatever you like, but do it consistently in a moderate dose. Okay.
So we're talking Ozempic.
We're talking Ozambique, Saxenda, Mounjaro, Victoza. There are many different brands, and they work slightly differently. They all belong to the same family, and they are they work on a receptor of the pancreas where insulin will be produced. So they work at this receptor, and it's called glucagon-like peptide 1. So, and they activate this receptor. What happens when we normally eat? Our body will produce this hormone, the glucagon-like peptide, and this hormone will go to the pancreas, and the pancreas will secrete insulin.
Right.
Okay, so and also that hormone goes to other parts of our body and goes also to our brain. So if we have enough of this hormone, it will go to our brain and will give the signal that we are full. Okay. So what we have more insulin, we have more insulin sensitivity with this kind of hormone. The stomach empties slower, that gives anyway the feeling of fullness.
Yeah.
And we have a signal that goes anyway to the brain and gives the signal of fullness. So this is how it works. Now, this medication, they were meant to be medications, and they are still meant to be medications for diabetes.
Yeah.
Okay. Two of them, the Saxenda, which is a daily injection, and another one which is not available here, I have written it because I always forget, I don't use it. So, Wegovy. Yeah, exactly. So those two are the only injections that are allowed. They are approved. They are FDA approved specifically for weight loss.
Yeah.
And also teenagers, children from 12 onwards can take it. Okay.
Wow.
Yes.
Under medical supervision.
Yes, of course, always. Always these kind of injections, they are not innocent injections. So please, I know that many women are very keen to take the injections, and I totally agree with that. You know, when I have a woman that struggles a lot and has insulin resistance, indeed, even if she doesn't have insulin resistance officially, but still struggles a lot and she has tried everything, then I don't find anything wrong to take the injection for a while, lose some weight, because losing the weight, by the way, increases the insulin resistance. So it's like a cycle, you know, the more weight you have, the more insulin resistance you have, and then the more fat you become, and so on. So you just cut it with the injections, that's fine, for a while, and then you maintain with a good lifestyle, or maybe with other medication. I will come to that as well. But it has to be always done under supervision. Why? Because there are some conditions that you are not allowed to take it, and that's very important to know. So if you have a history of thyroid cancer, please talk with your doctor. You have to let your doctor know about it, because there is a certain type of thyroid cancer that can be the risk. There is exactly. So aggravated, exactly. So if you have family history, or if you had, of course, thyroid cancer, so definitely that's something that you have to discuss very thoroughly with your doctor.
Could you just repeat the name of them?
The name, okay.
The
most
ones.
The
weight
injections.
loss ones. Yes.
The weight loss one, the one that has approval is the Saxenda, which is here, and also Victoza. I'm not sure if Victoza though is available in Dubai. In Dubai is Saxenda. With the one that it's very, very popular right now, and there is a reason why it's popular, is Mounjaro. So I'm sure many
Why
people
is that
have.
one more popular?
Okay, so Mounjaro now comes from the same family as Saxenda. So Saxenda is semi-glutide. Okay, so Mounjaro is something else, is oh my god, these names, sorry, I have to, tirzepatide, okay, so that's the Mounjaro, tirzepatide. So, and this works in two different receptors, not only in one, like semi-glutide does, it works in two. And there are many studies that have been done, and they show that the weight reduction is, to be honest, way better than the other. At least this is what the studies are showing. Okay, so there are studies, big, huge studies, double-blind, randomized, with thousands of people that have examined, that have compared Ozambique and Mounjaro, and the truth is that Mounjaro is you know,
leading the way.
Exactly, for weight loss.
Right.
You check the BMI, okay, and overweight is anything above 27. But sometimes you don't really need to be, you know, very overweight in order to feel bad. You know, sometimes
That is
it's
true.
just, it's just
Just
5
your not
kilos.
normal self.
Exactly,
Yeah.
exactly. That
Yeah.
you feel really bad, you
Yeah.
know, and you want to change it. And you start, how I start with optimizing your hormones. Because, by the way, we talk about everything else and we have forgotten talking about the hormones. Estrogen, which we have less in the perimenopause and we don't have at all in the menopause, is a hormone that increases the insulin sensitivity and you know, helps with the metabolism. Okay, so first I will try with the hormone replacement therapy. Definitely we will discuss about lifestyle changes, simple things like sleeping, you know. Then diet, whatever diet it's okay for you. I prefer the intermittent diet, and I discuss that with my patients. Yes,
Yeah.
And there is a reason. We will have a live maybe for that as well. But anyway, whatever diet suits you. And then, you know, you see some women, they will do everything. They will really do everything. They will be very good in follow instructions, in doing their own research, trying everything. And then they come really frustrated and they say, I can't, you know.
Yeah.
In that case, what I do is...
You say, I've got something for you.
Yes, yes. So in that case, I start with metformin. Okay, even first of all, from the beginning, I will check if there is official insulin resistance or not. Okay, so if there is not, I will try with other things. But if still everything has been tried and nothing has been done, then I will recommend metformin. Metformin is a medication, the glucophage, which you give also for diabetic. But off-label, it has been used for many things, for many years. So off-label, we can give it also to the menopause to boost and support the metabolism. Okay, and that seems to be helping some women. So, and by the way, just in a bracket, glucophages, there are many studies that show that it's a very good anti-aging medication as well.
What is?
Glucophages, the metformin. Glucophages. And the reason why it works as an anti-aging is that gives energy to the mitochondria of the cells. Mitochondria are the energy, let's say, the power factories of our cells, okay, and reduces inflammation. And also stimulates other molecules like NAD. I'm sure NAD, you have heard about it. That's a very good anti-aging molecule. Anyway, there are many, we can also discuss about that, but it's supposed to work also very good as an anti-aging and regenerative medication with very mild side effects. The side effects are at the beginning, the first maybe week, you might have upset stomach. Very few patients, maybe, I don't know, 2 out of, no, may I say 1 out of 10 will have to stop it because of these side effects. They cannot tolerate it, but usually it's very well tolerated. So...
Are you taking it?
I don't take it. I would like to take it. If you tell you now the reason, you will laugh. The pills are huge.
Oh my gosh. Oh.
And I really have an issue with that.
Me too.
Yeah, they are big.
I have a problem with little ones.
Yes. So that's...
Even my progesterone this morning.
Yeah?
Oh.
Okay.
And they're not that big.
I know, they are small, but they are sticky, the progesterone, right?
Yes.
Yeah, anyway, we can change to cream if you want. Okay. So, yeah, so I will try the metformin, and if that doesn't help as well, then I will talk about the injections, or what I do, I compound semi-glutide. Semi-glutide is the same as Saxenda. So I make a compound tablet, sublingual. Sublingual means that it goes directly to the bloodstream. It doesn't pass the liver. It will not be metabolized in your liver. So now I'm thinking it's not correct that it will not be metabolized. Anyway, it doesn't have the
If you want to go deeper into that, come and see
Okay.
Dr. Maria.
Okay, anyway, yeah, but the thing is that semaglutide, I give it along with B12 and NAD. NAD is anti-aging and for energy. B12 is good for nausea, against nausea. So, and you get the semaglutide. Of course, it's not that effective as is the injection, but still, you don't have to inject yourself every day or every week as it is with other injections, and still your appetite gets less, and it works also in the insulin resistance or sensitivity level very well. Absolutely, every woman can be helped.
Every woman will probably suffer from this, but
Yes.
the majority of women can be helped. So don't just sit there
Exactly.
and think it's just menopause and be unhappy about it. If you're happy,
Yes.
it's not healthy, but if you're happy, then that's your bag. But if you're unhappy, then do something about it.
Yes, yes. Even if you are happy, I would say, don't be happy of gaining weight, because that will become more and more and more. And if you have just 2, 3, 4, 5 kilos more, it's not a big deal for your health. But if you get, and it will get to the stage if you don't do anything for that you will have 10 and 15, and then you get to the stage where you're overweight and you're obese, and then the risks for your health are enormous. You have risk of cardiovascular diseases like heart attack and stroke. You have risk of diabetes, and with diabetes, again, the risk for heart attack, stroke, dementia, issues with your eyes, is your arteries, everything. It's big, so you don't want to have that.
So if you are overweight, I'm just going to ask you,
Yes,
if
yes.
you are overweight, are you happy? And are you accepting it? I'm really interested to know from you watching this if you are happy with your weight. Is anyone ever happy with it? I'm quite happy with my weight, actually, I'd say.
Yeah, there are people that in your weight they are happy with their weight.
But I work at it.
Yes,
this
of course,
isn't-
it's not.
I could easily
Yes.
put on weight,
Yes, true.
but I'm very
True.
strict.
It takes effort to in our age to keep this weight. There are people they are happy. The majority, let's say 95% of women that at least are coming to see me. I guess I'm kind of biased because I see the people that they want to
That are not happy,
to have some help. They are not happy. They are definitely not happy.
And so, are you injecting this, or are you? Or
So I refer to endocrinologists
Right.
because I think they are the right persons to do that. They can follow up, but I know that people will take it very easy and they will not have a thorough discussion with the doctor. So we said, thyroid cancer. If you have if you had pancreatitis in the past, if you have gallstones. If you have issues with your stomach and so on, those are things that you have to address to your doctor, and you have to discuss it thoroughly. Okay, that's very important because they are not, again, innocent medication. They are medication. They are coming with side effects.
Right.
Okay, but if you give it to the right candidates. The safety profile is good, and they work. They really work. With the injections, you might be able to lose approximately 2 kilos in a month. So imagine if you take it for 5-6 months, how many
It is
kilos?
quite expensive, though.
It is. It cost the Mounjaro at least. I'm not promoting any injection. I just want to make it sure. Okay. I don't even work with these injections. The Mounjaro is 1,700 a month. I think yes. It's my husband actually just got for this month prescription, and he paid 1,700 for 1 month. Maybe that's for the lowest dose. Maybe with the dosing coming up, maybe I guess also the price will change. but it never reaches more than 4,000, approximately 4,000 a month.
And your husband is not obese.
No, definitely. My husband, for example, right? And he's a man. So it doesn't have to do, that's why I was saying it's not only the hormones, it's the aging. He is 192 and he weighs like, I don't remember, I think around 100. So he wants to lose, it's been a long time that he's trying with diet, with exercise, just trying with lifestyle, doing the right things. And he cannot lose the last 5 kilos because he gained weight 2 years ago when he quit smoking. And he lost almost all out of it, but the 5 last kilos he's stuck,
Right.
And
So
I
he's
told
doing
him
something about it.
exactly.
Great.
First of all, yes.
I know there are medical reasons, but
yeah, I know.
they're saying it's not wrong.
Yeah, okay. Putting on a little bit of weight, which will happen anyway. And also, what happens?
I know what.
Yes.
Mother Nature's trying to make us more unattractive, so that the young women get the men.
Maybe,
The cavemen. That's what it is.
Maybe. But look, Mother Nature does also a lot of mistakes. Okay, all diseases in the world, they come from, they okay, of course, it's also our lifestyle and what we're eating but many things are genetics, there are genetic mistakes and so on. So, okay, Mother Nature will make us maybe a little bit, will give us a little bit more kilograms. It will not make us obese or overweight, okay? And the reason why it's good to have some fat, the reason why it's good is that in the fat, in the menopause, you will have estrogen production, which will help your bones not to, age very fast. So it's a prevention of osteoporosis. Will help your cardiovascular system. Our arteries need estrogen. So it's a good thing to have some estrogen from your fat tissue in your menopause. Definitely it's healthy, and this is why Mother Nature did that, and that's absolutely fine. But then again, we have to take into consideration and we have to be aware about the changes that are happening so that we can prevent, and we can live also, a few years ago people would live, average age would be like 50, 60. Now average age is 70, 80. And
Right.
this is because we have taken action, we know how our body works and we do things so that we make it work even better and for longer time, and we live better. And it's not only live longer, which is also something that we can achieve, but it's to live long and live well.
And out of hospital.
Exactly, not to be 80 years old and be,
Bedridden.
yes.
Yeah,
And you will be, if you are obese, the chances that you are really sick when you are old are very, very high. So the number one thing that we have to do if we want to be well as old for longevity and for good old age is to be at the right weight. We don't have to be lean, super thin. Some people are because their genetics are like this, okay?
And some because they want to be.
And some because they want to be. That's also okay. But then the very lean, for example, like you, okay?
Yeah, but there are some, like, am I allowed to say black people? Black people
Yes.
are leaner, they have muscle tone
Exactly, yes.
to die for.
Yes,
And that's
yes.
genetics.
Yes, exactly. That's genetics. We can work ourselves dead, to death to get this message. We will not.
Yeah.
It's not our genetics.
Yeah.
So, but very lean people, they have to know what is the risk of being lean at this age. And then you have to take action. You have to take medication to prevent other things to happen, like osteoporosis, for example.
And you need your protein. I've got my protein drink. This is my meal replacement, which I have every day.
What is this? Do you want to? I found it very interesting.
Health code. I'll send you the link.
Yeah.
But I need protein and I'm low carb, and so not all meal replacements work for me. But I don't eat 3 meals a day. That's another thing. Everybody tells you need to eat 3 meals a day. Not everybody does. We're
Yes.
all different. Don't do as you're told. Do as do what works for your body, what works for you.
You can try everything, right? And then find what
Experiment
from
is
all
great.
these healthy things, because we try only healthy things, what works best for you. Definitely. So
Yeah.
I want just to recommend a book for you. That's a
Book club.
very yes. No, I this guy, Dr. Rangan Chatterjee, he has a podcast from the UK. He's a doctor. His podcasts are amazing, very inspiring, and this book is very easy to read, really very easy, with a lot of pictures, very nicely written, and it's very practical. So I love him because he's very practical. He gives always tools. Night sweats is again one of the most common symptoms of perimenopause, that means, or menopause. So definitely the estrogen levels are not optimal. In the perimenopause, what happens is that you have a roller coaster, and your estrogen goes up and down, and this is what causes this kind of symptoms like the night sweats. The best treatment by far and the most effective is hormone replacement therapy. If you don't want to go on hormone replacement therapy, or you can't for what reason ever, lifestyle changes, good diet, exercise, and some herbal supplements like primrose oil.
Ashwagandha?
Ashwagandha, not for the night sweats. Ashwagandha is great. Yes, it help you, maybe.
In my
Ashwagandha. So look, yeah, ashwagandha lowers the cortisol, and also some doctors will give antidepressants for night sweats.
Wow.
Okay,
I didn't
so
know
that
that.
works as well, and maybe ashwagandha works in that way, because cortisol is lower, and you feel better, you have less stress, and then it helps with that as well.
Interesting.
But if we want to talk about specifically hot flashes and night sweats, primrose oil, it's something. But I can tell you from my experience, you can take any herb, it will help at the beginning, it doesn't last for long.
Right.
Okay, that's the truth.
Do you take HRT when you have when you start? If that's your only symptom, would you still go on to HRT?
If you don't have any symptoms, if you go on HRT,
If you just get night sweats. If you just get.
If someone gets night sweats, if she should go on HRT or
Yeah.
not, this is a question. Yes, I'm saying that this is the most effective
Right.
and definitive treatment.
Right.
Yes.
If you don't have a doctor in your area, then please DM me, and I will try and help you find a doctor wherever you are in the world. But we are very lucky in Dubai. We have Dr. Maria.
I'm very lucky to be here with all of you. And yeah, anytime, of course. It's not only hormones. We have to think always
The best
360. Yeah,
for each.
exactly.
So, but there is something to do. That's the main takeaway from this. You can do something about it. Don't just accept it if you're not happy.
Yes. And even if you're happy, think about it, because things are changing, and the older we become, the more difficult things are getting for us to change.
Yeah.
Okay. The earlier we get action, the better it is
There
for
you
all
go.
of us. Yeah.
Have a great day. It's Tuesday.
Yes.
And we will see you again in a fortnight. My daughter's getting married next week.
You will come with news. You have to show us something and tell us stories.
Show and tell. It'll be show and
Yes,
tell
yes,
in a
yes.
fortnight. We will see you in a fortnight. And what are we going to talk about?
Next time, actually, I would like to talk about IV drips. But
Okay.
I would like to invite someone who is specialist in that and makes the IV drips. Actually, he's the man who makes almost all IV drips in Dubai. Okay, and give us his life.
And is that menopausal?
It can be
Is that
menopausal
what
as
we're-
well. Yes, it can.
Okay.
Yeah.
So general women's health or menopause?
General and menopause. You can IV drips. You can have it. It's not only for women; it's also for men, and you can have it at any stage of your life. And the menopause, for sure, it gives energy and helps and boosts immune system.
Perfect. Thank you
Okay.
very much.
Thank you. Bye bye.
Bye-bye.
Bye.